Financial toxicity is a huge part of this, not only the cost of the treatments, but the other financial concerns, such as the patient not being able to work. Maybe they were the primary breadwinner of the family, and now, do they have savings? What are they going to be living on while the patient is undergoing treatment? Transportation costs, lodging costs. Hotels can be $200 a night, and many of our patients cannot afford that to be away from home for 30 days or so. To afford that for this type of treatment. So, that's a huge concern. And just the basic activities of daily living, food shopping and paying the mortgage and paying the electric bill, they all come into play in this process with the cost of care. So trying to connect our patients to our financial advocates and whatever resources we have, either with our social workers or other team members. Maybe it's a grant for something. Maybe it's, lodging through the American Cancer Society or different things like that. As far as some of the other issues surrounding, the CAR T-cell journey, besides financial, psychosocial is a huge aspect in, undergoing this process, especially if the patient does not have a lot of support. And we always try to assess our patients for their support systems at home, because this is not going to have a good outcome if the patient doesn't have support at home. Whether it be family, friends, and, as we've all experienced as oncology nurses, patients may live in a house full of people, but they may have no real support in that household. So that's a huge consideration. And, what is their psychosocial status in general? How are they coping with all of this? Are there other underlying medical or, mental health issues that we need to address before we put the patient through this journey? Because ultimately we want the best outcomes for them. And then I think from a physical aspect, just explaining to the patient, what the experience is like, what the side effects are of the CAR T-cell treatment. And they may be familiar with many of the side effects because they've already been most likely heavily pre-treated through their cancer journey. But explaining to them what the side effects are, what to report to their team, and some of the things that patients have told us they, will be experiencing, such as fatigue. You may not be able to do all the things that you did, and that's okay. We just want you to do what you feel you can do post-treatment, not to, go out and, do things that you wouldn't normally do or that are, taxing. You might have been in a great exercise program, but, post-CAR T-cell is not the time to go run the marathon like you were planning. You have to put some of those things on hold. And we really try to, work with our patients to try to get them to understand that they may have to take a few steps back as they're going through this journey to get to the ultimate outcome, which is, having the CAR T-cell therapy work and kill their cancer cells. Some of the things for survivorship after treatment, I think, are things that many of our patients experience. We want them to be knowledgeable about their disease. We want them to be know who they can go to for questions. We want to have the community educated, because many of our patients, like I said before, go back into the community. So we want their community providers to be educated as well, and to reach out to us if they have any questions or any concerns about the patient. We want them, the patient to be very knowledgeable and to advocate for their own care. We're here, but we want them to know in survivorship, that they need their ongoing follow-up, and we can help them with that. We need them to be sure that they get their preventative screenings, that they're connected with a primary care doctor. I mean, their oncologists are great, but they're not their primary care doctors, and many of our patients have underlying comorbidities where they need to be connected with a PCP for their diabetic management, their cardiac disease, their hypertension. So, all these things are important. Keeping up with their vaccination status if they are behind in their vaccinations, to make sure they get their flu shots, their pneumonia shots, their COVID shots when, they're approved by the physician. All of those things are really important in the follow-up, and making sure that they know that they can reach out to us with any questions or concerns.